Patty Jalal, founder for Foreign Policy Community of Indonesia. I want to welcome all of you who are tuning in to our discussion this afternoon. This afternoon, we will be discussing a very interesting topic, which is public health and pharmaceutical views of the COVID-19 pandemic. And to discuss this issue, we are fortunate to have three very important experts on this issue. One, we have Dr. Claudia Suryajaya, Regional Director for Asia of World Mosquito Program. And then we have the WHO representative to Indonesia, Dr. Parani Taran. And this is your third time speaking in our forum. And I know you must be very busy doing so many things. I feel kind of guilty actually getting you for the third time of our program. But it is a testament of your commitment to public service that you are attending today. So I look forward to hearing what you have to say. And then we have Ms. Irawati Setiadi, Chairwoman of PT Kalbe Pharma. How are you, Ibu? And you're doing a lot of exciting things. And I hear there's possibility that even a vaccine, COVID-19, is something is part of your project. So we wish you the best of luck for that. Just before we went on air, I saw a small discussion and briefing by Dr. Parani on the state of play with regard to the COVID-19. And I hope you will get to say that again on air. When do we expect a peak? What was the challenge in the past few weeks with regard to people leaving Jakarta, possibly bringing the virus to the provinces and so on. So again, I don't want to take up the time allotted to the speakers. I just want to welcome everybody and wish you a good discussions. And I pass the microphone to Pak Doni Setiadi.
Terima kasih Pak Dino. Well, thank you for that introduction, Pak Dino. Let's get this discussion started with Ibu Claudia's presentation. Ibu Claudia, the floor is yours.
Thank you very much. Hello, everyone. So I am here still in Vietnam. I moved here on the 8th of February and managed to go to the other hub, Oceania hub, and then I came back here mid of March and I'm locked here. But the Vietnam response is really good, and as public health, it's really interesting for me to actually observe and experience myself on the response of Vietnam. And then, so this is the topic of my presentation. It's a lessons learned from Vietnam. So Vietnam currently has 328 confirmed cases since end of January under present, and then we still have 0 deaths. And Vietnam is really small country. Actually, this is 97 million people, bordering with China about 1,400 kilometers, and this is the low middle income country. And the Wuhan earliest case is in November 2019, and the first reported case here in Vietnam is on 23rd of January 2020. That was during approaching the Tet New Year, where everyone went back to their hometown. So on 30th of January, we have 3 Vietnamese test positive for Wuhan pneumonia virus. At that time, we have not called it COVID-19. And also in 4th of February, we have confirmed cases. This is the 9th case from workers returning from Wuhan. So this is my experience first. So I arrived here mid of March, and then we follow up with 1 mandatory mask. That's the office here in the hub. And then on the 26th, we already have application on the phone for all travelers. This is the health declaration, and we need to input our passport there, and then it will go to the database and will be checked and revised as needed. On the 31st of March, there's already social distancing and lockdown. That's me, like I just ran a motorbike to go to the office, and that was my last day to the office. But On 7 April, Vietnam already managed to make test kit and even donate it to Indonesia, Laos, and Cambodia within 1 month. 15th of April, we still have social distancing that's extended for another week, and people follow. You can see from the photos, there's nobody on the street, well, except me who took the photos. And then 19th of April, park is still closed. 25th of April, look again, it's still closed with my social distancing. And 26th of April, there are repatriation of Warga Negara Indonesia stranded in Ho Chi Minh City. And that's thanks to our ambassador and also our consul general. But I decided to stay here. Started on 24 April, they did tracking for foreigners, including me. So they actually went to the management of the building and asked foreigners who still stay in Vietnam to do the testing. And this is, it's in a house, it's in a building. Well, anyway, so. All right. So Thursday, 30th of April, business is back. That's the first day. And then look in the mall. There is an Aeon Mall there, and look the number of motorbikes. Even though they still did the temperature check and also disinfectant check and mask. So I was so happy I can manage to eat my Kentucky Fried Chicken again. So in short, there are 4 phases for what the government of Vietnam responds. First is the controlling the imported case. That time, the number of cases only 18, and this is from the end of January until February 2020, when the first imported case from Wuhan, and then the Vietnam government stopped all the flights to Wuhan that time, and followed by forming the National Steering Committee for COVID-19 disease prevention within 1 week. And in February 2020, the first domestic transmission leading to an epidemic declaration. This is suspending all school activities across the countries. This is after that. So schools already stopped after that in early February. And also control the market price for masks, hand sanitizer, and other essential items. So it's the supplies are there, and it's the price is controlled. So everybody get access to that. So phase 2, the virus has spread globally. The number of cases that time is 69. So from 15th of March, the border and traveling control is basically the travel restriction. All international flight travelers must be quarantined 14 days before entering Vietnam, closing all the borders and reducing the domestic flights, including closing all entertainment service like bar, club, karaoke, and cinema. And then, like I mentioned, the health declaration is applied for everyone. This is available by app and website. Phase 3, infections started in the community and then increased the number of cases by 3 times, almost 3 times actually, in 283. This is April 2020. When controlling the epidemic and implementing economic and social measures taken by the Vietnamese government. So this means officially implementing national social distancing, no domestic traveling at all, and close all unessential business. But people can still go out to the market and buy food with considerable social distancing. But the government also encouraging and implementing charity activities to provide food and hygiene care items for economy affected population. We all heard about the rice ATM and gift packaging and etc. So phase 4 is resuming. That time we will only have 3 number of new cases. This is 22nd of April until ongoing. We are still in recommended social distancing, but masks, but it's not really strictly enforced because currently we already on a week 7 of no new number of confirmed cases. So this is double the incubation period actually. So we are back to normal. This is not even the new normal. We are normal. Traffic everywhere and people already started the office. So this means gradually lifting the lockdown, prioritizing cities in 3 groups, high risk, medium risk, and low risk group, and reopening domestic flight and ground transportation. Now just recently, 2 days ago, is back to 100% capacity. And students start to be back to school with prevention measures still in place. So still temperature check every time and also mask when entering the building. So business reopens with prevention measure, no gather more than 10-20 people wearing masks and temperature check. So what are the measures? The measures like, first of all, in the early, we have the king home or the commemoration of the first king's death, and people gather in the temple in the pagoda to celebrate this. But the government already put the measures to cancel this mass celebration. This is really big day in Vietnam, but the government already took action to cancel this annual ceremony. And people will, police will find people who spread fake news. These are like people who spread hoax and use this to measure how to control hoax and fake news. On March 6th, because of all this concern about COVID, of course, people went to the market and tried to buy all the food, everything. But within 1 month, on the second day after the nationwide social distancing campaign, food are available everywhere. Supermarket opened. Of course, we still have to wear masks, but no worry about food supply, basically, or basic needs. Then effective communication. This has been done since the beginning. So they put a lot of social media information, awareness, including how to wash your hands correctly. They put a lot of media from YouTube for young kids as well, for teenagers and with dancing. So this is very informative and also very friendly message, and people listen. So also introducing fake news fines for coronavirus misinformation has been done in the early. And isolation and quarantine based on personal risk, it's gradually elevated. So social distancing, then self-isolation at home. The government already introduced classification F0 to F5 on 17th of March. I can show you the F0. So F0 basically, person has identified just the same like Indonesia, orang dalam pengawasan, ODP, and then suspect. So, but this has been done very early in March as well and gradually improve. So from to also trace the contact. So for example, people in close contact with F1 will have to report who he met or she met previously, and then so to increase contact tracing. And then it's escalated. Back to this is then centralized isolation. This is 14 days quarantine in center or hospital and even military camp. But the government provide free COVID-19 tests and also free supplies of all essential stuff, basic need from the government, food, everything, even internet in the center quarantine, even in the military barrack. So the fourth one is, of course, centralized isolation. We have city isolated, and especially now because a lot of the repatriation of Vietnam's workers as well, they could not fly to like international airports in 3 big cities. They have to fly to nearby cities. So it's easy to isolate if there is a positive case. So these are the classification we already learned, and they also printed guidelines. They put it everywhere in public place, make it easy to understand and people read. So not only that, improving screening, diagnostic tests, and treatment, which of course this WHO can talk more about this, is very important when curbing infectious disease. So COVID-19 patients are only discharged from the hospital after 3 times negative result. Then not even that, when they go back, they need to still have self-isolation in 15 days in their own home. Business shows solidarity, and that's why the price of masks and hand sanitizer, we can still control it. And not only that, several pharmaceutical companies or companies selling products, beauty products, they start also making masks. So that's why supplies are there, and also the price is not escalated. And so basically people here listen to the government and act. And this is the saying, staying home is the love for your nation, for the nation. And they have 3 three tasks to do. That's the report the coughing to the health authority, report fake news to the police, and then report who ran away from quarantine to the social media. This is actually a propaganda poster in the past, but now they turn it into also propaganda information sharing about COVID-19. So lessons learned. What made Vietnam successfully respond to this COVID and still zero death? It's early response from the government. So the act since the first confirmed case reported in Wuhan. This is 1 month before WHO announced COVID-19 as pandemic. WHO already put a public health emergency of international concern on 30th of January. So Vietnam listened to this guideline and act. So the decisive action by the leadership, they make sure that COVID-19 is a major threat and health over economic growth. This is the decision. And that's why followed by action, border control, health declaration, and quarantine. This is actually a quote in CNN 3 days ago by Deputy Head of the Infection Control Department, is the Ministry of Health, that say that we were not only waiting for guidelines from WHO, but also using the data that they gather from outside and inside the country to decide to take action early. So early response. Beside this, of course, the public health prevention, this is aggressive contact tracing and multi-tier isolation that I already mentioned before. So tier 1 is confirmed case, isolate and treat in health facilities and treat in health facilities. Tier 2, close contacts of confirmed case, they should be tested and do to government quarantine. And tier 3 is close contacts with tier 2, they can self-isolate at home. And tier 4, isolate the entire communities, village, neighborhood, hospital. And it's really interesting because when people isolate in their home, the neighbors also look after. And then when somebody found out that they go out from their home, then they will be reported. So the community really protect each other and follow what the government asks them to do. So lesson learned again is early diagnosis and prompt treatment, targeted testing. That time we did not have a lot of testing, but it's also improved. The test kit produced, increased lab capacity to perform RT-PCR, and MOH always develop and frequently update treatment SOP. I'm not mistaken, now it's already version number 5. So they keep on updating the SOP for treatment. And again, single source information, raising awareness and change behavior. So private sector also support the health system and public compliance. I want to show, hopefully this time we can see the video. This is the ATM rise.
I remember.
Okay, so this is just to show solidarity from the private sector as well to support the entire health system. Vietnam health system is not strong.
Remember once I was
I have the link. You want to see it again? Okay. That's the end of my presentation actually, and I've been here for more than 4 months now, and I miss Indonesia very much. Even when I sit in a warung just to eat, I saw that clock looks like pate, so I miss pate very much. And I hope Vietnam now domestic flights already open, and we are considering to open also for international soon, but also to put maybe the first country to open for tourism and tourism back. So thank you very much. And as we know, this is no boundaries, and no one can solve the complex problem alone. Thank you.
Thank you, Dr. Claudia, for your presentation. That's very comprehensive. It's good to know how other countries fight the COVID. Next, we have Dr. Parani's presentation. Dr. Parani.
Thank you, Pak Doni. Terima kasih. Let me get my slides up. Ambassador Dino, Pak Doni, my fellow presenters, Ibu Claudia, Ibu Ira, and all the audience who are watching virtually. This is part of our new normal. So the idea of this presentation is to focus more on the public health perspective on what is happening on COVID-19 and give a bit of an update also what is happening globally and in Indonesia. And then I was also asked to touch base on whether to lift the restrictions or not. So that's kind of been covered. As always, it's a pleasure to be at Foreign Policy Committee Indonesia, and I would like to take this opportunity to actually congratulate and appreciate the good work that Ambassador Dino and team is doing of bringing a lot more information and more on this important and current topic to the general public and for the foreign policy community actually in Indonesia as well for both. As always, my presentation, while today is 8th June, the information presented is valid only as of 6th, so possibly 7th morning. And that's the latest information I have over here. So globally, what this map shows is the last 7 days, but global situation is we are coming close to 7 million cases. And as of today, I think we have passed more than 400,000 deaths. What is interesting in this global map is that there's a shift that you have a high number of cases now in the last 7 days we see in USA, Brazil, a bit on Chile and Peru and Mexico on the Americas side. And on the right side of the map, Russia still continue to have a lot of cases, then India, Pakistan, Iran, Saudi Arabia, and South Africa on much darker colors. And the top 10 countries, which have in terms of the total number of cases, it's always interesting for me every time I update this slide almost on a weekly basis. Some countries surprises me. Brazil have become the second largest number of cases in the world. And then India, which was not there like 3 or 4 weeks ago on the top 10, has now come to the 5th place in terms of global cases. And just one other point is that I think a month ago, we were receiving about 80 to 100,000 new cases a day globally. And then last few weeks, it has come slightly over 100,000. And yesterday, the last reporting cycle, we had 137,000 new cases reported globally. So if anybody is thinking that it's slowing down globally, no, it is not slowing down. The reported cases daily is keep on increasing. And we do have Indonesia-specific SITREPs on our website, and this is the latest one on a weekly basis. I have a lot of analysis and information. You can always check that on the WHO.IND Indonesia website. And let's move on to Indonesia. This is the latest number that was reported as of yesterday, 31,000 plus cases, 672 new cases reported, and 1,851 deaths. As you see in the maps, it has spread to all 34 provinces in Indonesia, and more than 400 districts already have reported COVID-19 cases. So it's an active spread all over Indonesia as well. Now this graph shows basically the orange pillars show or the columns show the daily confirmed cases, and the blue line show the cumulative cases. If you look at the orange in the last 2 ones, basically, yesterday, Indonesia reported 672 cases, and on Saturday, Indonesia reported 993 cases. That is the highest number ever reported on a single day in Indonesia. So things are not really slowing down. Things are actually going up in Indonesia as well, overall as a country. In some places, it may be coming down, but overall, as a country in Indonesia, the cases are not going down. There's one disclaimer I put for this data, because this data is not necessarily reported or current, because when a test results is reported sometime, it may take up to 1 week from the time of testing. So we are cautioning people of using this for a proper epidemiological analysis or for a curve, because the data there's a lag time in the reporting of the results. So then we are talking about relaxing PSBB and what to do. Now, this is the biggest challenge I think everybody have, right? People want to do this, but can they really actually do that? And there's a lot of pressure that people face. So this slide basically show the trade-off in the decision making. On the left-hand side, what you see is maintaining public health and social measures, and what are the benefits of that. We reduce the risk of transmission, we reduce the burden on the health system, and also potentially avoid a resurgence of a second wave. But on the right side in the blue, what you see as a point is that we need to mitigate the emerging economic crisis. If we keep on the restriction, then we are going to face a difficult time there. So that puts a pressure to lift the restriction. And then there are social consequences. It's not just about economy. While people are locked down globally, we have emerging evidence that there's a lot of mental health issues that are coming up in a number of countries, but also gender-based violence is increasing because people are all locked inside the households. So there are other social consequences that are happening. And then we need to reduce the implication on food security and travel and trade, job security and others. And also there's one other thing of people say it's good to lift it because you may get some herd immunity. And that may reduce the chance of a second resurgence. Again, these are questionable, but these are the arguments for and against. So what do we do? How are we going to handle this then? So the guiding principles of decision making should be based on risk assessment and quality epidemiological data. These two are critical for the decision making. And at any point you lift some measures and then you may have to bring the measure back. So it's not like a one-point decision, okay, we have lifted it and this is it. No, you lift based on a lower risk and based on solid data, and then you have to bring it back, and you do it in stages. So if the risk is found to be lower and you have high quality epidemiological data available, then it's a time to make a decision on, okay, maybe we can relax a bit, but it has to be done on a stage by stage basis rather than a straightforward lift and then we open up to the old normal. So let's see what's happening in terms of a criteria for it. So these are the selected criteria WHO has proposed to the government of Indonesia to assess the transmission in Indonesia, right? This criteria will tell us whether we are okay to open up or not. So the epidemiological criteria, the first three, if you look at, basically we are talking about a reduction of the incidence or new confirmed and probable cases to be at least 50% over the last 3 weeks period from the last latest peak. Same way, to get only 5% of the samples testing positive in the last 2 weeks, provided that the surveillance is comprehensive and all the suspected cases are tested. And then decline in the number of deaths in the last 3 weeks. This is the epidemiological criteria. Further, on a health system side, what is important is we need to see a decline in number of hospitalization and ICU admissions in the last 2 weeks. Why it is important? Because if you do not see the hospitals getting freed up, if you open up, then you're going to get loaded and the hospital is going to overflow and is going to go beyond the health system capacity. The third one is a surveillance criteria. The new cases can be identified, reported within, and analysis and all have to be done within 24 hours. And 80% of the new cases have their close contacts traced and in quarantine within 72 hours. And 80% of the contacts of new cases are monitored for 14 days. These are important criteria if you want to keep the transmission low while we relax any form of restriction that is already in place. So let's apply the first set of epidemiological criteria to a set of provinces, particularly in Java Island. So this is what we have done. This is based on data of the last 2 weeks of May. So it's a bit outdated as of this week, and we'll be updating on our weekly SITREP. And when we apply these three criteria, whether cases are coming down, whether positivity rate of lab positivity rate is less than 5%, or whether the deaths are coming down, this is a result. In most of the provinces, all three criteria are not met. In 1 or 2 provinces, one of the criteria is met, and this is a real situation. Jakarta we have not seen more than 50% decline. It's less than 50% decline in the last 3 weeks. We have seen more than 50% decline for 1 week in West Java, for 3 weeks in Central Java, and 2 weeks in Jogja. Again, there's a disclaimer that all this is based on information that is reported from the provinces and in the national database. And for lab positivity rate ranges, and all of them are more than 5%. And deaths have only come down in the last 3 weeks, only in Jakarta, and all the other provinces have not seen a decline in the deaths reported in the last 3 weeks. So they're not necessarily meeting the criteria for opening up. Further on the laboratory, what we have done in this graph is that the number of tests performed by these provinces are in the blue color column, and the red dots give the positivity rate as a proportion. What this shows is in Jakarta has met the minimum standards for the testing in terms of 1 test per 1,000 population per week. But nevertheless, the positivity rate is 10.6%. When they meet that, the positivity rate should be less than 5%. And if it is less than 5% in Jakarta, then that is an indication that transmission is actually coming under control and going down. So it's not going down in Jakarta based on this. Almost all the other provinces have not met the minimum criteria. Nevertheless, the positivity rate is extremely high. And that again shows that they are not ready for relaxing the restriction totally. This is again a specific focus on Jakarta. The graph on the left side shows the number of confirmed cases in each week. It was kind of a pulled together as a weekly number, and then cumulative number is shown in the graph. We were looking at last 3 weeks decline, and you can clearly see there's no clear decline happening in the last 3 weeks. Actually, there are different peaks coming on each week. And if you do this calculation for this week, that may be even higher. So Jakarta, things are not really coming under control. In the last 2 days reported cases, there's more than 150 cases reported yesterday for Jakarta, and on Saturday, more than 100 cases reported. This is an increase from previous 60 or 70 cases reported. So Jakarta is seeing an increase now. The reason for the increase is partly because a lot of people left Jakarta when the schools closed, and then when the Eid holidays came, now people are returning back. And when they left Jakarta, Jakarta had a high transmission, and a lot of people carried the virus with them to the villages and the other provinces. Now people are returning to the city because the transmission is high in other provinces, and they're bringing it back into Jakarta. So we are going to see an increase of cases in Jakarta at least for the next few weeks before it can come under control. On the right-hand side, this graph basically shows the deaths. The blue one is the deaths among confirmed cases, and the deaths among the suspected cases in Jakarta. The good thing about Jakarta is overall the number of deaths are coming down, and that's a positive sign. That means it's not necessarily about transmission, but it's more also about that the health system is doing a better job in saving lives as well in Jakarta. So what are we going to do? We are talking about relaxing, but then things are not coming under control. So we need to define the new normal. And this slide is basically, I'm trying to see what are the non-negotiable measures under new normal. This is what WHO is proposing to Indonesia as the 5 non-negotiable measures, public health measures or social measures under new normal. One is to continue to keep an active, robust surveillance and case reduction with PCR test of all the suspected cases. And the minimum standards, there are 2 standards have been outlined here. One is at least 1 PCR test per 1,000 population per week, every week in transmission areas. This is not a global national indicator, but for a particular location or a target population area. And then results of this, sorry, it's not PCT, it's a typo, it's PCR test, should be made available within 24 to 48 hours. And this is one of the most important non-negotiable measure under new normal. Second is rapid isolation of all suspected and confirmed cases. We have seen Dr. Claudia explaining in Vietnam how they have isolated and quarantined people quickly, and that's important. A third one is appropriate clinical care for those affected by COVID-19. Again, we don't have an effective treatment against the COVID-19 itself. However, symptomatic treatment, and we do have case management guidelines out there. A fourth one, and a very important one, is the extensive contact tracing and quarantining of all contacts. At least 80% of the new cases have their close contacts traced and in quarantine within 72 hours. And then the contacts have to be followed up and monitored for 14 days. This is again a critical part. And also Dr. Claudia explained how Vietnam was doing that at household, even at community level quarantine. And this is an important non-negotiable measure of new normal for Indonesia. And then of course, we have to continue to ensure that people frequently clean hands, wear mask in public and workplaces, and maintain physical distancing of at least 1 meter. This is non-negotiable. It doesn't matter how things are. For now, the new normal means we have to keep on frequently cleaning hands, we have to wear masks in public and workplaces, and maintain physical distancing of at least 1 meter in Indonesia right now and the current context of transmission. We may change this later if totally we have 0 new cases for a long time. But for now, these 5 measures are critical and non-negotiable. Since we are in a public seminar, so what are the basic protective measures under new normal for people? Please clean your hands frequently with an alcohol-based hand rub, or just soap and water is fine. Avoid touching eyes, nose, and mouth. Please remember the transmission happens through your mouth, nose, or eyes. And it's very difficult not to touch. But if you want to touch, please wash your hands first and then touch your eyes, nose, or mouth, because that's how you're going to get the virus onto yourself. Maintaining physical distancing is important, at least 1 meter distance from other people. If you can do more, that's better, but minimum 1 meter distance. And leave home for essential needs, and when possible, work from home. Even if the PSBB and others are restricted, that may happen in July, make sure you reduce your movement, that reduce your exposure. As long as there are cases reported in a location, and if you live in that location, you need to reduce your movement and protect yourself. And if you go out in public or workplaces, please wear a fabric mask. This is a 3-layered mask, non-medical mask, and we'll have it on our website, what should be or how that mask should be. For in general, for most of the people, just wearing a fabric mask all the time is helpful. Medical masks should be considered for vulnerable populations, such as people over 60 years or people with underlying conditions. If they are going out or into workplaces, it's better for them to wear a medical mask and properly wear it and protect themselves. So this is the guidance on new normal. And before ending my presentation, I have not talked about any of the pharmaceutical measures because so far we don't have an effective treatment. We don't have an effective vaccine for it. All right. So probably I may talk about it later. Thank you. Terima kasih.
Thank you, Dr. Parani. You ran out of your voice there a little bit. Scary, but thank you for that truthful presentation about the situation in Indonesia. Next, we have Ibu Irawati presentation.
Okay. Thank you, Don, for having me. Thank you for FPCI. Okay, let me prepare. It's not coming out. Okay. Slideshow. Okay, so I hope I can give a little bit perspective from the micro side. Okay. So just a little bit introduction of Calbe. So we are established in 1966, and right now our turnover is 22 trillion in 2019. And we have been a public company since 1991. And there are 4 business divisions. There is a pharmaceutical, which counts for 23%. Consumer health, which is the OTC, it accounts for 15%. Nutritionals, 29%. And we also do distribution and logistics for third parties. There are 41 companies in our business, and we have 12 GMP, that's good manufacturing practice facilities, and 76 branches all across Indonesia with 17,000 employees working for us. So how do we handle the COVID-19 when we heard about the announcement from WHO? So first of all, we have to look at our supply of raw material, because most of our raw materials come from China. Yeah. Some raw materials are from Wuhan, but Mostly it's come from all over China. It's about 91% of our raw materials are imported, and China contributes 1/3 of it. So we were quite worried when we learned that Wuhan was locked down. But I will go through that later. So the other concerns that we have is how do we protect our workers if we have the raw materials but there are no workers, so it's not good also. And mind you that was in, I think it was in early February and going to March. So we don't understand a lot about this COVID-19. And then the third is that we realized that there are going to be a lot of changes in the consumer behavior because of this PSBB, not a total lockdown, but there will be changes in the consumer behavior, which makes us anxious of how the consumer will deal with this, and how we as a company have to respond to these changes. So what we did was to ensure the continuous raw material, to ensure that our factory can keep on running. And then, of course, we need to have measures to protect our employees' health and safety. So from the 17,000, I think 30% are factory workers. And of course, we have to adapt to the consumer changes and collaborate in research and R&D for new products development. And also, the last but not least, we have to enhance our digital presence. So as I mentioned, to ensure our continuity of raw material, as I mentioned before, the fact is that 91% of Calbe's product are the raw materials are imported from China, which contributes 1/3 of it. Excuse me. And when we calculate, we were rather alarmed also that there's a potential, there's a potential loss of 300 billion rupiah from April to August 20th. And if there are basic drugs such as paracetamol that we cannot make, that is very alarming. So what we calculate, at that time we calculated how much stocks do we have, and we start to source across from China, outside Wuhan at that time, and also going to India and other mainly India, because most of the European factories are also shut down at that time. And we tried also to build relations and partnership with the local vendor that has some spare stocks. And of course, we collaborate with BPOM, and Kemenkes, or the MOH, who are very forthcoming at that time to help us also ease the process of importation. I think I remember, if I remember right, at that time, I think we have a 2 months or 3 months stock from finished good all the way to the raw material. So at that time, we thought that we have to quickly try to find some replacement for our raw material. Otherwise, in 3 months we will be running out of medicines. Yeah. And then also, yeah, number 2 is to protect the employees' health and safety. Just to go back to number 1 is that, for your information, we at Calbe, we make many kind of products, and actually we don't have, as mentioned by Dr. Parani, there is no drug for COVID, and at that time hydrochloroquine was mentioned, and so we don't make a product from hydrochloroquine, and then so we really have to find sourcing for hydrochloroquine and chloroquine. But also for the vitamins that to protect, to increase our immunity, it's also not a big part of for Calbe. So also we really had to scramble and try to find sources so that we do not run out of vitamins, any kind of vitamins. Basically, mainly it's vitamin C, vitamin D, and B complex. Okay, so number 2 is to mention on the slides is to protect our employees' health and safety. So we have to really take a look at the standard operating procedures and make adjustment with it. So we do quickly, we do health checks and monitoring to all employees, checking their temperature every day. And then we also have we do a survey online to check almost the 17,000 people just in the branches and also in the factory, to ensure that they can still work, although there are limitations. Yeah. And then we also provide them with masks and vitamins and letters to make sure that they are allowed to work, to work from their home, from their houses to the factory. And of course, in the factory, we do also testing, but that was after, I think, around 1 month, because we need to procure those tests, whether it's a rapid test or also for the PCR, because at that time in March, I guess we are not ready to face this pandemic, and we don't know much about the virus. Okay, and then we also have to adapt our products. As I mentioned, we don't have a lot of products that that's especially catering to COVID. So it was in a very record short time, we try to come up with a variety of products, from vitamin C to vitamin D, and there is a special jamu or herbal drink which we call susu jahe merah, because jahe merah, which is red ginger, was touted by the government, by the president also, that it helps to increase our immune system. So we try to source and come out with a product, and of course hand sanitizers we launched also. And at the beginning of that was in March, I think. In mid-March. So we also realized that our clients, our customers, which are mostly hospitals and outlets, yeah, mom and pop shops, they're also experiencing a lot of problems in getting PPE, and so we working with BNPB, we help them to get the PPE, and we donate 25 billion rupiah in terms of medical supplies and doing PCR tests, and also giving out vitamin and nutritional products with whatever we have, and also providing healthcare information through our telemedicine application platform, Click Doctor. And also in the later stage, we have through our network of partners from Korea, we co-develop with them a vaccine. So for COVID-19. So we are quite surprised that they are also ready to do a phase 1 trial. But our partner, which is Genaxin from Korea, they have this platform they use to make a DNA vaccine for HPV, for cancer. So that's why they're trying to with this COVID, they're trying to use the same platform for COVID-19. I hope it will work. We'll start the phase 2 trials after the phase 1 trial this coming June, and hopefully in 6 months to 8 months, that means 2021, in the first quarter, late first quarter or second quarter, we will have a product ready. We hope so. And then also with hydroxychloroquine, we also, because we didn't have a product, we also imported, and then we have to formulate, and then we will distribute it. And I hope it's still working because of the different development, yeah, that we heard about hydroxychloroquine. So we are really we're being alert and trying to see whether and study whether hydroxychloroquine can really help with the COVID patients. And of course, we do also other clinical trials with other partners and institutions for our herbal also. As I mentioned above, we have some herbal products. So we are working with the Menristek, with BRIN, and with LIPI to conduct, and we're conducting starting this June. We are conducting a clinical trial using a few of our products also. Okay, and then as I mentioned, also there are changes in the consumer side. So luckily we have a already existing a platform for telemedicine, and it was also it was good also for MOH to permit for e-prescription, because before it was forbidden, but because of this COVID, now they allow for e-prescription. Okay, so that's a short short story from the micro side of what we have done, and together again we hope we can defeat this COVID-19. Thank you.
Thank you, Ibu Irawati, for your presentation. Let me start off the discussion. Hopefully this is an easy question for all three of you. Looking at Dr. Parani's criteria of ending the lockdown, it seems pretty clear that Jakarta or Indonesia is not ready, right? What would your advice be from experience such as Korea or Singapore that has to, when first they open their lockdown and then they have to reimpose the lockdown. Can you share some light on that to all three of you?
All right, and I will start on basically from my experience here. It's gradually the government did it step by step, and then they categorize it the cities based on the high risk category and then medium and low risk category, and then the lockdown lift up the ease up is based on that characteristic, like number of cases, also considering number of people living there and the border and the geographical area. So it's step by step, and also for the ease up itself, they started with just open public places like small restaurants can open, but even until now, even though it's back to normal, we just only started a major event like sport event, biking yesterday, and we're already on the big 7. So it's not drastically open at once, but step by step.
Okay, thank you. Dr. Parani and Ibu Ira?
Yeah, let me come in. Thanks, Padoni. I think I do agree with what Claudia proposed as a step-by-step approach, and that's what is being planned by BNPB and Tugas and Ministry of Health. They've come up with together of identifying zones by different color codes, and those which are green that has 0 cases. And there are certain pockets in Indonesia, even some districts and others have never reported any case. And if they do, if they are testing the suspected cases very well and still having 0, there's no reason why they should be keeping everything closed. So I think that's the approach government of Indonesia is doing, and we have seen the plan was all presented and others as well. And they're trying to do in a similar way based on the risk assessment, as we said. Risk assessment and quality of epidemiological data are 2 critical parts before making the decision. And that's what they're doing. So it's not like all of Indonesia is in red zone, no. There are green zones within the red zones or on the provinces. In the map where I show, it was just a provincial red. But within the red, there are green zones everywhere. The same in DK, Jakarta as well. There are green zones in Jakarta. And there's no reason why that should not be open up. And going for a step-by-step approach and based on a clear risk assessment and epidemiological data would help Indonesia to open up slowly and steadily. And if a green zone turn into a yellow, orange, or red zone, then they can always close it. And it's almost impossible to keep a full lockdown for a long time for all the economic and other consequences that we discussed during my presentation. So there's nothing wrong in opening up. And this is why we are trying to define what is new normal. Having continuous risk assessment and epidemiological data is part of the new normal, as I explained during my presentation. Over to you.
Okay. Ibu Ira?
Yes, from a business point of view, I guess we are looking forward to relaxing this PSBB, because we are experiencing that in the outside Jakarta, the shops and the outlets, they are reluctant to open, and so I think starting this May, June, it's really, from the business point of view, Q2 will be really a challenge, because if this lockdown is prolonged, it will affect the distribution, the sales of our products. But I also can understand that if this pandemic goes on, and there's we are also worried that we cannot get a increase in the economy. So I hope that it will be done step by step, and that education reminder to the people is consistent. Yeah. Otherwise, we'll all be like this for a year, 2 years. It's not healthy, I think.
Okay. My next question is also for three of you. Maybe you can shed some light. There is an article in Kompas that talk about the cost of treating patient in Indonesia. Cost of treating COVID patient in Indonesia is between 105 million to 215 million. Compared to Singapore is between 61 to 82 million. Compared to Thailand is about 48 million. My question is, why is it in Indonesia to treat COVID patient is cost so high?
Okay. This is my understanding from the testing point, and the testing in Indonesia in the early days. We need to have 3 tests, and then the patient's cost will increase, because from the second test, we have to wait to 10 to 14 days before we can get the PCR should be negative. And maybe because also the cost of the PPE, personal protection, is also high in Indonesia. Even surgical mask is like very high. We experienced that. So it's adding to the cost. Basically, what I heard is in one hospital, the cost to treat is 7.5 million a day per patient. And then we have to wait for the test for 14 days before clear it. Then, of course, it becomes 105. But I do not know the current situation now. Maybe it's already reduced, because we also have a lot of funding being redirected from donors agencies to also support the governments to reduce the price. So maybe other panelists can explain more about the current situation.
Thank you.
Sorry, can I add, in Singapore, actually right now, even if the test is still positive, they say that this is the remnants of the virus and it's still under observation, but the patient can be discharged. So this is reducing the cost as well.
Okay. Dr. Barani?
Yeah, thanks, Padoni. I think so our case management guidance have already changed. We do not anymore expect any negative PCR test as a criteria to release a patient. As long as the patient is free of the symptoms, fever and others broke down for 3 days, they can be discharged. So I think that's going to dramatically bring the cost of treatment down, because PCR tests cost a lot of money as well. And then when you have to continuously do that, that's an additional cost. And also in the case management guidelines, when after a certain period, even a recovering patient, without symptoms, they can be moved to normal isolation, and they don't have to be in a high unit of full isolation, and where all the health workers and others have to wear PPE all the time. Because the transmission is happening at the time of when the symptoms are beginning, rather than at the end when people are recovering. And there's more evidence to show that, and based on that, we have revised the guidelines. So I think even the use of PPE for a patient throughout the whole 2 weeks or 3 weeks of stay is not necessary anymore. Once the fever has broken down and for 3 days, no fever and others, they can be moved into a unit where it is not as like an ICU kind of a setup, but they don't have any symptom. They can be moved into a much normal ward. And all these other extra wear of PPE and other requirements have been all relaxed. Some countries have already started doing like Claudia explained, like in Singapore. And Indonesia, we are working on revising that guidelines with the professional association and others. When it is revised, the cost is going to definitely come down. Over to you.
Ibu Ibra?
Yes, Don. We do not deal with the patient directly. Yeah, it's through the hospitals. And what I heard is that the hospitals get reimbursed quite quickly from the MOH for these COVID patients. So I think it's the hospitals that determine the prices. I don't know. I'm not so aware or know a lot of how they determine the prices. But actually, we do give also free PCR test and rapid test. We do the drive-in rapid test and also rapid tests conducted with like about 10 hospitals in Jakarta and Jawa Timur and Jawa Tengah.
Okay. Ibu Ira, I know in one of your presentation, you mentioned that 91% of raw materials coming from import. After this COVID happens, do you think it's feasible for you to open up the raw material facility in Indonesia rather than import?
Yes, I think that topic has been discussed, for many years, why Indonesia do not have their own raw material factories, yeah. But I think it has been tried like 20 or 30 years ago to have a factory here. But I think we are a little bit too late for that, and that's why at Calbe we jump into the biologic raw material. So we are working on that. For the chemical side, I know some state-owned companies are also starting to manufacture the final stages for the raw material production. So I hope that will help to ease the burden of having to import from overseas. But there are so many raw materials. There are thousands raw materials for making a drug. So we have to choose which can have a sizable and have volume, and we can export. Otherwise, it is not feasible. You cannot beat the Chinese for the chemical raw material.
Thank you. My next question is to Dr. Parani. It seems that WHO is not only fighting pandemic, but also fighting political battle against United States. How does political battle divert resources in fighting COVID-19?
Thank you, Padori. I think it's a great question. Just to clarify, we are not fighting with any of the member states, including United States government.
Only with President Trump.
No, not at all. Just for everybody to understand that WHO is an intergovernmental organization. And we have 194 member states, including United States. And the member states form our governing body, and they hold the secretariat. We are called the secretariat as World Health Organization. And all of us are part of the extended secretariat, and we are held accountable by the member states. And this is done through World Health Assembly and Executive Board. Now Indonesia is a member of our Executive Board. And so they hold us accountable in terms of all our work globally. And we also have regional committee at the region. So a member state demanding certain accountability is part of our normal process. And in this particular case, US government have specifically stated certain concern that our headquarters colleagues are looking into, and they are working with them. And we continue to work with US government and various entities And US government and the American people are a generous donor to WHO. Beyond the access contribution membership fees, they also provide a lot of resources, including for our response in Indonesia. We have received funds from USAID, from the American people. So this is an ongoing partnership. Now, what is happening globally is that we do have an independent expert oversight and accountability committee, and including which has members who are independent experts from USA, and they have put an initial report that is available on our website. And based on the request from member states, we will be evaluating our work as well as hopefully the joint work of all the member states in the coming months or years at an appropriate time. And this is part of that feedback that we receive and sometimes criticism from our member state, and we try to change and act accordingly. So there's no fight going on between US government. We do work very closely with US government agencies, including with US CDC and USAID in Indonesia in our day-to-day work. Over to you.
Thank you. Next question is to Dr. Claudia. Dr. Claudia, in your experience, do we have enough resource, especially in rural areas, to fight this effectively, to fight COVID-19 effectively?
Yeah, this put me back in my experience when I was deployed in my early days as a young doctor in Papua at the time, Irian Jaya. I bet for 25 years our health system is better now. We can have, we should be able to prepare better. My concern is the geographical remote area where even just to find PPE for doctors is very difficult, and there are a lot of groups now supporting the doctors and paramedics in the rural area to get basic protection. Yes, we do, Don, but again, it depends on the people. So what we learn also from this country is people listen to the government. And if we are out there and with resource is always limited in many settings. And then even in developed countries, resource is always limited. And then that's how we have to do this together. Diplomatic, Ministry of Health, not only Ministry of Health, but everyone. So yes, we can, but how we do it, that's another question. And how we do it.
My follow-on questions to you is that why do people in Vietnam listen more to the government? Is it because they're a communist country that's used to, I guess, police state, for lack of a better word, that they follow whatever the government is saying? Or what's your take?
Right. I got this question very often. And of course, this is a socialist country. But it is very important to have promotion, and Dr. Parani can confirm on this. If people want to do it by themselves, then it will be easier. So how to increase people's awareness and to change the behavior. That's the message. And then I think Vietnam successfully delivered that message of health promotion, and it's sinking in everybody's head. So without being asked or being chased to wear masks, they're wearing masks. Even right now, entering building, they're still doing that. Still do hand sanitizer, because the message sink in already. And this is how we do the social media or promotion, how the work in the posters, all the health information should be there. And once it's sink in, they will follow the government said, not just because the government said, but this is because they think this is important for them to protect themselves and to protect the nation.
If that's the case, Dr. Parani, maybe you can, my follow-on question is to you is, do Indonesian government give enough warning or messaging that's enough to sink in, just like Dr. Claudia said, to public?
I think so. I mean, I have been following Bapak Jokowi on his Twitter and other messages as well. And even at the beginning, we have seen Bapak Jokowi even showing about how to wash hands and all of that. So I don't think it's that they're not doing enough in terms of the messaging, but how much of that sink in and how much of people are practicing that is a different aspect of it. Indonesia is a heavily decentralized country. And it's a much larger country with multiple islands and others, and different people have different behaviors in different parts of Indonesia. So it's not easy in a country like Indonesia to be able to uniformly implement all the measures and hold people accountable. And I think there's something in that solidarity and the way people work between Vietnam and Indonesia, we may see a different characteristics. And I think we have been in discussion with Gugas, BNPB or Ministry of Health, and this is a constant discussion. How can we actually make people change the behavior? And evidence shows that behavior change does take time. It's not something that you can do in a few weeks or others. So it's going to take us time. And that's why we are trying to frame this discussion on new normal to be what are the different behaviors that we would like people to see in new normal. And we don't get to go back to the old normal at all. And that's the current messaging that is going. I think the messaging is right. In terms of penetration, it's going to take us time. And that's something we have to work together. It's not just about whether government is doing it or all the partners are doing it. I think we need a whole of society approach. And that has worked very well in Vietnam, and hopefully we are in the right direction, and we look forward to see that also working in Indonesia in the coming months. Over to you.
May I add something, Don?
Yeah, sure, go ahead.
Maybe also important here, people do not believe in hoax. So they follow the information by the government. They check every time they have other information, because it is true in Indonesia, we like to, with this era, we receive a lot of information, but how to screen that information is very important. So that's probably also lessons learned here. And fake news and hoax, people here, they really do not entertain that and really just listen to try to abide by the correct information.
Okay. Ibu Ira, do you want to take a step at this question? Why people in Indonesia is not as disciplined as compared to Vietnam?
Well, I'll just take a look at what's happening in Calbe. So in making products, our drugs, medicine, they have to use PPE, shoe covers, and head covers also, and mask. But I guess in a company setting, it's required to do that, right? And
Yeah.
so we do have training for the factory workers, and yes, we do a lot of training for them. And also for the marketing people, because in the factory, well, they have to come in and they have to go into their locker and do all the sanitization, right? But in the marketing team, marketing people, they're out there in the branches, and so we cannot watch over them every minute or every second. But I guess it is a challenge for us also to in the office setting, that we need to be disciplined. So we keep reminding through the internal communication, through the computer. So it's something that we bang on to everybody here. I guess I don't know how to compare that outside the office or the company setting. But that's we realize, to make a good product, you need a good quality product. You have to start from the people. So our concern to right now is that we can educate and we can teach our people when they are in the office to be hygiene. But when they go home, that is something that's not within our control, and we are also worried that they can contract the virus and bring it to the office, because there are a few cases, and when it happened, we just have to close down the whole entire floor. Yeah, there are many. It's in the office, so we have to clean the floor, and they have to be in isolation. So that is it's not good for productivity, but that's what we have. That's what we have to do. I think making I don't know how to put it, but to make them realize the consequences, to scare them that hey, if you go to the hospitals, you will be put into ventilators, and this is what happened. That maybe that's how to get them to follow the orders. Say you have to do this, something like that. Maybe the government have to scare
Scare them to death.
The people, yeah. That there's no alternative but just follow what is being told by the government.
Okay, Ibu Ira, you mentioned that the vaccines is probably will be out on around the first quarter of 2021. How confident are you in that timeline? And number two is BPOM is notoriously slow in their approval. How is that situation coming?
Yeah, it is surprising that in this kind of crisis, actually we are all coming together and trying to help each other. So BPOM and MOH, they have been forthcoming, as I mentioned. They have been forthcoming to help us, the industry, to cope with this pandemic, and how we can help also the nation, the Indonesian people and the government to tackle this thing. So for the vaccines, yes, we usually it takes 3 phases, 4 phases to complete the study. But in this situation, in this crisis, they are trying to put phase 1 and 2 together. Yeah, and they're trying to do that in Korea. And of course, here in Indonesia, we have, from the very beginning, we have informed MOH and BPOM about this clinical trials. So I think that will also help to speed up the clinical trial here in Indonesia.
Okay, Dr. Parani and Dr. Claudia, with this vaccines, how do you make sure there's an if we found it, if say in 2021 first quarter, Calbe found the vaccines, how do we make sure that there is let's just assume that's the only vaccine available in the whole world. How do we ensure there is an available amount of vaccines to distribute throughout the world? Will there be, I guess, patent limitations? So say, for example, Calbe will not be able to patent it, so people can use it rather than for the benefit of Calbe. Sorry, Ibu Ira, for making that example.
Thank you, Padoni. I think so. Globally, what is happening is, as WHO, we have launched a massive platform for accelerator of all the different products. And part of that is also a call to action that was launched recently, and Indonesia is part of that, to relax all the intellectual property and others, to share all the findings and others openly, so that the vaccine, identifying a vaccine becomes fast-tracked. Because different people are in different parts of the processes, but if everybody bring all the scientific knowledge together without worrying about the patents, we can actually fast-track. So there's a lot of that already going on globally, and WHO has a solid platform of bringing everybody, all the countries together. Now, in terms of availability or equitable distribution, there's a clear agreement globally that any vaccine that is produced will be equitably distributed under that platform. And this is also with all the manufacturers and others. So this is an ongoing work. Now, say if an agency like Kalbe Pharma or another manufacturer, Biopharma or somebody in Indonesia, wanted to start manufacturing a product or buy in bulk and do that, that also will be facilitated through that process in a way that all the countries and all the companies have it. Even some of the big companies are already working with other companies that have the manufacturing capacity to be able to manufacture a particular vaccine parallelly in different locations in the world, depend on manufacturing capacity. And this is unique for COVID-19 because the normal holding back the patents and intellectual property rights is kind of everybody is working together. Even I have to admire and appreciate all the companies and vaccine manufacturers, even all the people who are the front running all these different candidate vaccines are opening up to share this. So if any one of these front running vaccines is found to be effective, let's say in the first quarter next year, by that time, we should be having at least 1 billion doses of the vaccine or probably more manufactured and be available for distribution right away. And that's what people are working globally, and WHO is coordinating and working with a lot of the research partners, but also the vaccine manufacturers with Global Alliance for Vaccine Gavi and other partners as well. Over to you.
Thank you. Dr. Claudia?
I just want to add a bit that currently there are countries lobbying and push, currently said, to make global patent pool. So to reduce the steps in long steps to have vaccines available due to the patent as well. So this is ongoing, and especially we have cases like this during the public health emergency and COVID, of course, this is public health emergency. And then we do the pool patent pool, patent pool, global patent pool.
Okay. Next, I will open the questions to the public. There is first question coming from Nadia Parisa from Pramadina University. Indonesia's mortality rate is one of the highest in Asia. What are the causes? Is it because of the lack of public health service or the fault in testing and data reporting? I guess it's open to anyone.
Okay, let me take the first shot at it. Now, if you take a global average of the case fatality rate, Indonesia's case fatality rate is just in line with the global average. However, in Asia, we have other countries which have much lower case fatality rate. There are a number of possible reasons. One is that because Indonesia's testing was limited at the beginning, we have not really captured a lot of the asymptomatic or people with mild symptoms at the beginning. And most of the severe patients got tested and confirmed, and therefore the death looks like very high because it's a denominator issue. I think the denominator in Indonesia is way much higher than what has been reported as confirmed cases. And therefore, we are not worried about the case fatality rate as such, that it should be a much lower rate. Because we have not identified all the cases, it looks like a bit higher rate compared to other Asian countries. But even as a current number, I think as of now, the case fatality is 5.9%, which is in par with the global average case fatality right now. Over to you.
Dr. Claudia, Ibu Ira?
Yeah, I just want to add what Parani said. It's important to see it as a rate and not absolute number, because of course the denominator is the confirmed cases, and we have more confirmed cases. And then, as in many other diseases, if we have prompt diagnosis, that means and testing, that means we will see more cases because we do the diagnostic better.
Okay. Ibu Ira, any comments?
I think I agree with both my fellow panelists that we need to do more testings so that the denominator will be adjusted.
One question: when people say asymptomatic patient, what does that mean? Does it mean that the patient will never get sick, or is it just he will be healthy, is just keep on passing the COVID to other people, or will he or she get sick?
Thanks, Baroni. I think when we say asymptomatic, what happened is in COVID-19, a lot of people have either a very mild symptom or just no symptoms, right? But they are also part of the confirmed cases, because by WHO case definition, anybody who is tested positive by a PCR test is a confirmed case. So if you look at the number of tests done in a country like, say, South Korea or Singapore or others, they have done massive testing. So their denominator of confirmed cases is much larger. And Indonesia has not done that amount of testing. And therefore, the denominator is smaller. So as a rate, the case fatality in Indonesia looks much higher than these countries. If Indonesia has done, say, 100 times more testing, I won't be surprised to see at least 10, 20 times more cases identified. But these are most likely mild or simple cases. But also remember, among the suspected cases who we have not seen the test result yet, we did have a lot of deaths. So it's more of a number issue than an unusual high number of deaths in Indonesia, because we do work with Pulmonology Association, other association, and government to look into this data. It's only when we have expanded testing, we'll be able to better tell what is the real case fatality and is it really different from other countries in Asia. And that's something we need to work on the lab testing all over Indonesia. Over to you.
Okay. Next question coming from Andre CIPS. Flattening the curve is to buy time to increase healthcare capacity. Has Indonesia's capacity to handle or treat cases increased enough to handle new infectious for new normal?
I think that's a great question, Andre. For now, we are monitoring. One thing, Indonesia has expanded the bed and ICU capacity tremendously. When we compare to February or March, when they first confirmed the cases, and now Wisma Atleti is adding additional beds here, and the same is happening in all the provinces as much as possible. So we are seeing a significant increase in the number of beds and ICU capacity, and more ventilators and others are available, and PPEs available as well, as when we compare with March and now in June, in the 3 months. So yes, the health system capacity has been expanded significantly in these 3 months. We have not seen the full utilization of all the ICU beds and the beds available for COVID-19 yet. So there's plenty of space in the health system to be able to accommodate more patients in the health system. If you look at today as COVID-19 and look at the bed capacity, we have more than 300,000 bed capacity available for COVID-19. And we only have 31,000 patients who have been even confirmed so far. And quite a number of them are already recovered. So we are not even utilizing like 10-20% of the, more than 10-20% of the capacity of the COVID-19 overall in the country in terms of capacity. So there is plenty of capacity available in the health system. And that's why we have put one of that as an indicator. So in case we move into a new normal, and new normal does not necessarily mean opening up everything. And if you go back to my slide on the 5 non-negotiable measures, these are part of the PSBB in a way. So what we are telling is, instead of restricting the businesses, you open up the businesses, but you do maintain all these public health and social measures. So if those are maintained, we are going to still be able to keep a lower transmission that is within the health system capacity. And so far, we have not seen the health system capacity breached by the new number of cases. It is still within the health system capacity, very well within the health system capacity, based on our continuous monitoring. And together with Ministry of Health, we do monitor the health system capacity and the beds and occupancy in all the provinces. With the new change in the case management guidelines, that if we can also release the patients early when the symptoms have come down, that's going to also help us to free up more of the health system capacity. So currently, so far, we have not seen an overflow of patients against the health system capacity in Indonesia yet. Over to you.
Okay. I guess my follow-on question may be to Ibu Ira and then Claudia, because of the all available resource is pulled towards COVID. What about preventing other disease like dengue sakit jantung or other disease? Do you see maybe a long-term effect will come up from as a result of fighting COVID?
That's precisely what I was going to add after Parani's respond to the question. So coming back to the health system, Tony, what we can learn also from Vietnam, this is country with weak health system. This is not really developed countries. And we understand that, the government here, they understand. So what happened is if all patients, non-COVID also came to the hospital, plus COVID patients, if we didn't do better contact tracing, the health system will collapse. We don't have enough hospital, health facilities, we don't have enough doctors to do that. So what they did here in Vietnam is actually, even in Ho Chi Minh, they have 5 referral hospitals, said guard the patient very carefully, the COVID patient. So one patient can be attended by 2 or 3 specialists, infectious disease specialists, just to stop the transmission. And also they try to avoid other patients coming with other disease. So out of these 5 reference hospitals, the other health facilities try to boost also their service. And then because they understand it may collapse the system. And to talk to your point about dengue, the symptoms of COVID-19 is actually, it can be similar with dengue. I work here for the World Mosquito Program and we try to fighting dengue as well. So now it's rainy season. The dengue is there, not only here, but also in Indonesia. During COVID, we have a lot of patients of dengue as well. So to really understand our capacity and that we are not there yet, and then the measures is taken. And just to remind everyone, we actually still have 1 patient here. This is the pilot, the British pilot, and he was in really bad condition. His lung capacity is only 20% that time, but now it's improving. He's attended by 20 doctors now. This is the pride of the nation. We don't want to have to break the 0 debt. So, and now he's recovering. It's amazingly 40% lung capacity now.
Dr. Ira? Ibu Ira, sorry.
Yes, I just heard from the hospitals here in Jakarta, at least, that the COVID patients are declining. So now people are already, they're not afraid to come to the hospitals. So that's a good sign. So that was the same question I asked my pharma team also. What's happening with the onco patients? They cannot stop. They have to go to get their radiology and chemotherapy. So I think that's okay. But for the degenerative diseases, for those who have diabetes or hypertension, during last month, the last 2-3 months, they stopped coming to the hospital. So that's that's scary. I hope it doesn't jump after this COVID. So I hope that it's manageable. But yes, now elective surgery are being done, and slowly the hospitals here, at least in Jakarta, the private hospitals are already opening up for other patients than COVID. So that's a good sign that the business or the economy is moving along.
Yeah, may I add a bit on? So actually for like long-term patients such as tuberculosis patients which need the drugs every month for 6 months. So I think not only here, but also in Indonesia, we try to do the double prescription. So it's not only monthly for the patients that routinely come, then we can give 2-3 months supply. So to reduce the visit to the hospitals as well during this situation.
Okay. My last questions to all three of you. If you could advise President Jokowi, what advice could you give?
Wow, this is a big question.
Anyone?
Hanging there, but this will be over. It's tough. Yeah, we are a nation with 270 million people, so it's big. Yeah, and then sometimes we don't listen. Often we don't listen. So I think, but Jokowi, you're doing a great job now, and then people start aware and understand, and then hopefully this will be over soon. Hang in there, but I don't know, Parani, you have our president. What is your recommendation?
Let me see. Let me come in. We have been advising and sharing guidance and others regularly with the government. So that's an ongoing work. But I think Bapak Jokowi's announcement recently and the incremental announcement of first targeting 10,000 tests per day to 20,000 is a very smart way of handling and making sure the system build the capacity over time. So I think that's going to help us, as we all know that the lab testing is a cornerstone of this pandemic response. So that's a very brilliant and smart move. Kudos to Bapak Jokowi on that. And perhaps my humble request is to, I'm sure he's holding all the different provinces and districts accountable, but if he can hold the people who are in charge accountable to make sure that is broken down to all parts of Indonesia and start demanding 1 test per 1,000 population per week in the hot zones. And the zones that are not green, but the zones that are orange and red and yellow should do at least 1 test per 1,000 population per week. It's more of a holding the next level accountable from Bapa President, because having 1 target globally per day for the country is very helpful to hold Tugas and ministry and others accountable to do it. But it might be useful to make sure that it's broken down to every province and districts with ongoing transmission. Over to you.
Ibu Ira?
Yes, I think kudos for Pak Jokowi for what he has been doing. What I would like to add is that for his for the ministers that are helping him and all the other government bodies, that we need to work more together to be aligned with one another so that we can execute this to the provinces well. So alignment among his subordinate, those who are supporting him, that will help us, the companies, the industries also, and especially for our industry, it will help us a lot if there are more alignment among the ministries.
I want to actually not advise, but this is a request to Pak Jokowi. Please, Pak, I want to go home. So if Indonesia is not improving, Vietnam is talking about opening the borders with countries and allowing international flights to countries which has good response. And I like my slide. I miss pete so much, yeah, Pak. I want to go back to Indonesia.
I'll send you some pete, Claudia.
So please, all of us, let's make this happen.
Okay. That concludes our presentation. Thank you to all the panelists. Thank you to our audience for listening. We have more discussion in the future to discuss about COVID and its impact to foreign policy, to society in general. I would like to say to everyone, please stay safe. God bless us all. God bless Indonesia. Thank you.
Thank you, Pak Doni. Thank you, Ambassador.
you.
Bye-bye.
Terima kasih, Claudia.
Tadi ketemu lagi ya.
I didn't realize you are in Vietnam.
Bisa pulang. Saya kabar nih.
Okay.
Everyone.